Hey everyone, welcome back to the Contempo Coding live stream. It is Friday afternoon, a wonderful day to do a live stream, and I think I'm gonna start doing them more consistently. But I think I need some advice from you guys. I'm not sure if you like the AMA style where you just get to come in and ask questions very casual, or if we should move towards almost like a planned thing where I go over kind of a couple of targeted topics or even bring guests on. Definitely let me know in the comments below. Excited to see you all here today. Hello to Teresa. Hey everyone. Hello to Gwen. Yeah, so I do want to talk today a little bit about modifiers and especially the Cigna thing. I'm actually getting a lot of requests to talk more about the Cigna. If you haven't seen it already, I made a short TikTok, like 4 minutes long, on some of the highlights of the whole Cigna Modifier 25 situation. It is a hot topic right now for sure. I'm seeing LinkedIn user, which I believe is my friend Sonal. That usually is it. But hey, oh my gosh, I almost forgot to cue up the theme song. We can't forget that. So, hey everyone, sit back, relax, say hi to your friends in the chat, and let's get started with today's live. All right. So, hey to all of my friends. There's a lot of people coming in from LinkedIn. Oh, hey, John. Good to see you in here. I know the ad libbed combos are fun. You know what? I did my first TikTok live this week, and it was like even I think a little bit more relaxed. I'm not sure how I feel about the TikTok lives as far as doing them on like a weekly basis, but it was a heck of a lot of good conversations going on. And I wish I could stream there at the same time as I'm doing all of this. But right now, can I do a book tabbing video for 2023? That's an excellent question. So I still haven't tabbed my 2023 books. I am not a huge tab person because I don't do productivity coding anymore. So I'm not like trying to shortcut to flip to things as much. So I honestly have probably been in my ebooks a little bit more this year than I have even been in my physical books. But before I forget, yeah, let me add that to my list. So, fun fact, for those of you who don't know, I have basically a giant Google spreadsheet that's got like hundreds and hundreds and hundreds of lives on it where I basically just keep all of my ideas for videos. So anytime someone's like, hey, can you do a video on such and such? Like I make sure I add it to the list. It doesn't always get made, but I make sure that it's on the list so that I go, oh yeah, you know what am I going to do this week? Oh, that's right. Someone wanted me to make a new tabbing video, which I don't think would be too hard. I mean, the other one is I mean, it's pretty much the same system, except for I think since the previous tabbing video to this one, we added chapter 22 onto ICD-10 CM, which I think I did talk about in that video. But yeah, it might be and let me know if you think it would be cool if I did the tabs that came with the book, because I know there's also a girl on Etsy that sells, like, custom-made printed tabs. So maybe I, like, buy one of those sets and compare and contrast the tabs that come with the book versus the ones that you can purchase online and see if we think those are, better, worse, makes a difference of ours or what have you. But let me add that onto my list here before I forget. Content ideas. What number am I up to now? And I actually have different tabs for all of the different platforms for the content. I'm up to this is will be line idea number 340. 2023 tabbing video. Love it. Yeah, I think that might not be a bad idea. I'll see if I can buy one of those Etsy sets. I know sometimes they run out and we can compare and contrast like what comes in the books versus like should you invest in purchasing that something from that's kind of like made by coders for coders, right? Yeah, you know what, Lori? A lot of people have said, I mean, especially if you're a student and you're carrying them around into like a physical classroom, like it's almost like worthless to put the tabs in because as soon as you stuff them into your backpack, like they're all bent up, folded, they get stuck at the bottom of the bag, all kinds of stuff. It's not the best. Can you please talk about what websites to go for when we have questions? That's a good question. You know, I think Facebook groups are great, and Lori, in fact, actually moderates a handful of them. That might be some of your best bets, I think, these days is to really go into Facebook. And Lori, feel free to plug what ones you think would be best that you help moderate as far as coding questions. If you're working in a specific specialty, I know they have different Facebook groups for like orthopedics and stuff. And of course, if you're posting things there, please, please, please be cautious about posting anything that could be construed even as, private health information from patients. So not even I would even take out like "Oh, this is a 43-year-old man, from Ohio," or something, or that works as a co like anything that could even be construed, as personal health information, I would take out. So that's probably your best bet. There are AAPC forums. I don't think a lot of people are active enough in them anymore that if you ask like a coding question about a case or something that you're going to get a lot of response. If you have questions though about the AAPC, I'm going to do my friend Alex a favor here and tell you that you should check out AAPC's social hour. They have all kinds of videos. Oh gosh, I can't remember what day of the week it is. Is it Wednesday or something? But check out the AAPC Facebook groups and pages, and they'll live stream there with the social media director Alex, and he brings in people from like the National Advisory Board or the board of directors or that work for the magazine, and they talk about stuff that's going on with the AAPC. So if you have questions about like the company, that one I would say, yeah. So yeah, random stuff saying AAPC forum, no one responds. Back in the day, that used to be the thing, but not so much anymore. I don't think a lot of people utilize it much. And I don't want to say it like forums, aren't as active, especially personally hosted ones like your company's forums. They're just not that active anymore. Reddit, you might have some luck with. I know there's a fairly active medical coding Reddit that you could check on. Um, I'm not up to snuff on like the Discordy server stuff. This is a great question. Is there a way I can print a copy of the ICD-10 CM guidelines? Yes, there is. There is ones that you can get from the Center for Disease Control and from CMS. So what you would want to do is, and I can show you exactly what I do. Let me just scroll over here. Nope, that's the document camera, Victoria, which is marked as document camera. There we go. Da, 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 da. And they just updated in April, so you wanna make sure you have the most recent one. ICD-10 CM Guidelines 2023. And again, you wanna look for the websites, either CMS or CDC. I feel like I like the ones from CDC a little bit better, but ooh, excuse me. They have them. Yeah, these are the ones for April 1st, and you can download the document here. It's I'll tell you, 118 pages. So it's a long document, but if I remember correctly, the APC still allows you to take a separate printed copy into the exams. And I think the reasoning behind that was because of these mid-year updates or because sometimes the guidelines didn't get printed in the books back in the day or something like that. But you are, from what I understand, unless they very, very recently changed it, always go back to the APC. Um, but they have it there. And the CDC website has it as well. You can actually download, I'm sorry, CMS website, and you can download it there pretty easily. So let's go over here. My throat's all scratchy today. Yeah, here's the whole set of ICD-10 CM guidelines. If you go to just the 2023 ICD-10 CM page, it'll give you like everything you want ICD-10 wise. They're not like as nice and formatted for you as it would be if you were doing like an ebook. They're just going to be very raw data type files. Let's see here. Present on admission again. Okay, codes tabular list, for example. If we open this up, big old zip file. Beep bop boop. It's taken a good minute or two. Okay. So, like, here's what's in this section. Our neoplasms, our drug tables. Here's our tabular list. They have it in, it looks like a PDF and an HTML document. So let's open the PDF. And if you ever want to kind of build your own ICD-10 CM book, you can just merge all of these PDF files. But like I said, since they're not formatted nicely, they are very, very robust. So let's see how many pages where my pages are. But it's a pretty large amount of, pages to download the whole ICD-10 CM manual. Look, it's crashing my computer. Do you see it spinning right there? We might have to control alt delete that program. Look, it crashed. It crashed. The ICD-10 CM manual crashed my freaking Adobe. Ah, Lori, that's a good point. ICD10data.com. Yeah, you could use that website as well, um, and search through as well. The nice thing about ICD-10 is it's not, copyrighted, trademarked, etcetera, so it's, like, free use for everyone to use. Oop, let's get out of there. You don't need to see all the stuff in my Google Drive. After getting my CPC, how long should I wait to get my CRC? You really don't. I don't think there's so the only time I would say there would be a reason to wait, because with the CRC, the majority of it is testing you on your in-depth knowledge of ICD-10 CM, and you already have some knowledge of ICD-10 CM with the CPC. The differentiation is that in the CPC, there's only a handful of questions that are specific to ICD-10 CM. CRC is going to have a lot of questions about ICD-10 CM, right? So I don't. My the one exception I would say to waiting is if you've just gotten your foot in the door with a new job. I want to make sure that you know what you're doing at that new job, that you're not overloading yourself, because if you're trying to study for a new credential and learn a new job at the same time, that can be stressful and you could wind up burning yourself out. You don't want to perform, you know, not to the caliber that you could at that new job. So you want to focus on that new job for at least that portion where you're kind of in um your introductory time, that first like 3 6 months. Otherwise, I would say if you've got the time to study for an extra credential, a CPC, CRC, like, go for it. So you're a CPCA, you're looking for a new job, or if you probably your first job, right? CPCA. Should your certification number be listed on your resume? You don't need to. Some people will say, like, "Oh, that's like your social security number. You shouldn't put it on there." Um, I don't think it needs to be necessarily on your resume as long as they see that you have your credential. I always say at the top of your resume where you have your name, your credentials want to be right after that. However, um, however, if a recruiter asks for, to verify your credentials, they're gonna need that credential number. I actually memorized mine recently, isn't that terrible? Because 'Cause I've been using it so much, and they can do it 2 of ways. They can do it either with your AAPC member ID and your last name, or your email address and your last name on the AAPC website. Speaking of jobs, so something interesting happened the other day. So I used to promote this website, and I haven't done it in a while because it's been down, but a year, 2 years ago, codersdirect.com was the place to go if you needed a medical coding job, and that you could filter it by which credentials you had, and it was great. But then the person who ran codersdirect.com decided to retire, sold the website. You saw nothing, months on end, nothing on the website. I thought it was just dead, like he couldn't sell it to anyone. Went to check it the other day, and codersdirect.com is back. I have no idea who bought this, and I'm still trying to figure out because there's no dates on here, so I don't know if it's, like, pulling old jobs and they're still in here, or what's going on, but yeah, Coders Direct is still up. Lori, did Brian Cui take it over? Did he? That's funny. Quiet about that if he did. But yeah, codersdirect.com is back up and running. So again, like I said, I don't know if this is all old stuff that's still in, but the site's up and active again. So there you go. Another place to search for websites. So codersdirect.com is back up. Um, let's see. Codersdirect.com is back up. Indeed.com, LinkedIn, Facebook, Google Jobs. Yeah. So there it goes. Let's see. What have we got here? I know I saw a bunch of questions coming in the beginning, so I'm scrolling back up because I know sometimes um, I hate to people feel like I'm missing them because I just have to scroll up and go through the question. By the way, did you guys see the new setup? Check this out. So before I had a couple of pictures that were up here and the glass panels were reflecting too much on my lights, so I had them taken down and I got this new shelf to put my knickknacks on. I had some people that are telling me that I need to put the back on it, so the backs are, like, literally cardboard that you have to nail on, but I want to maybe put some LED lighting on here, and I feel like I can't do that if I have the lights on, but I guess I could tack some strips on and then put the backs on, but I don't know that the backs need to necessarily be there for, like, structural integrity of the knick-knack shelf, but now you can appropriately see silver play button highlighted in the back. Nope, that's not the one I wanted. Okay, so this one's a great question. What are the pros and cons about taking the CPC online versus in person? I have heard so many horror stories about taking it online. Uh, so first I want to say this. For those of you who aren't aware, right now with the in-person exams, they are all proctored by AAPC local chapters. So there's a group of between I think 3 and 6 people that run the chapter. They're all volunteers. They don't get paid to do it. They're not employees of the AAPC. They do it out of the kindness of their own hearts, right? So those volunteers are tasked with finding places to host the in person exams. It's been a little bit of a struggle since the pandemic because they used to host them at a lot of hospitals and healthcare organizations, and they kind of shut down and said, no, you can't come in anymore. And we've seen some of them starting to be allowed back in, but not all of them. So it's up to so sometimes with the in-person exams right now, there's not a lot of control over environmental things. If the temperature isn't great, if the lighting maybe isn't great, if you know, our organizations used to host them a lot in the hospital, and then they would play a little lullaby every time a baby was born. So you'd be in the middle of the exam and you'd hear na 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 because someone had a baby. So they don't always have the best control over some of those environmental things. Now, starting January 1, the AAPC has indicated that they will move to testing centers. I haven't seen a lot of details as far as what testing centers. I'm gonna place my bets on the fact that I'm gonna place my bets on it being a Pearson exam center or the same that HEMA uses. Um, so that might be a little bit more strict starting January 1 versus, the local chapters that we've historically seen. Sometimes, you know, you might have a chapter where the people that are proctoring haven't done it before. They maybe don't know what they haven't read the instructions as clearly because, again, these are volunteers. They're not employees of the AAPC. Chapter officers can change from year to year. So there are regulations that they have to have 2 proctors. And let's say those 2 proctors are new people. They've never done this before. And they didn't recognize that maybe you're not supposed to have, I don't know, sticky notes as tabs. So maybe some people got away with using sticky notes as tabs that shouldn't have. Well, that's probably gonna be a little bit more strict now when we move to the exam centers, because the exam centers are notorious for being like, you have to make sure, you have all of these and these and these because they're really liable then for the protecting the integrity of everything. So, benefits of taking it in person, of course, is, um, you're gonna be around other people. You're going to have that comfort of, if it's somewhere you're familiar with, you might have that set of familiarity. Taking it in person, you're allowed to have snacks with you. You're not allowed to have snacks with you when you take it online. You're only allowed to have, like, a beverage. You don't have to worry about tech setup. You basically just show up with your books, your ID, and you're kinda ready to go if you're taking it in person. Online, you like my desk right now that I have, let's see if I can kinda show you. Let me switch over to let me see if I can show you. Oh, no, maybe. There we go. Okay, so my desk, I wouldn't be able to use. I would have to set something else up somewhere else because there's too much stuff on my desk. When you take the exam online, there has to be nothing on your desk but your books and your ID and your beverage. So you can't bring in um, pencils, you can't have highlighters if you wanna write something down or bookmark a page. I was able to, I think for the online exams, bookmark my pages because I had, like, one stray little tab that I put in my book and, use that to bookmark my pages. So, yeah, so Laura's saying, yeah, they even make you take your camera and scan your desk, so I don't think I have my stick here anymore. But basically, you can't use the webcam that would be, like, in your laptop. You have to have almost like a webcam on a tripod or, like a selfie stick so that you can move it around and show them all what's in there. You can't have anyone else in the room, you can't have your dog scratching at the door, it has to be completely quiet. If they start hearing things, they'll stop you and be like, "Hey, what is that?" One of the cons too of taking it online is most of the people that are proctoring are overseas, and they do tend to have heavy accents. So while they're reading the instructions, it can be very difficult to um, understand the accent when you're also trying to pay attention to all the wording. So if you haven't read all the instructions ahead of time, you because of the heavy accents, you might not pick up exactly what they're saying, and that can be stressful. That would be stressful in a normal situation. In an exam sort of situation, even more so. We are at 109 people watching this live stream right now. Holy heck. I think maybe the AMAs are doing better than the than the structured ones. So yeah, definitely some things to think about. I'm not saying one is better than the other inherently, but for you, there might be some factors in there that might make it better or worse. Another pro, though, of taking it online is you can schedule it whatever time you want. So if you want to take it at 4 a.m. on a Wednesday morning, like you can schedule it at that time. They're very flexible. Elizabeth, that's a great question. So if you want to pass the CPC exam, you took a medical billing and coding course over 2 years ago, right? There's a couple of things to think about, right? So you might want to think about um, a refresher. And let me tell you, there's a couple of refreshers. So if you're at that point where it's been 2 years, you might not necessarily need a review class. I have one on contempocoding.com if you just think you need a review class. You can also look into buying the Bucks step-by-step books. They're great. So they're the ones I recommend. Do I have them here? Oh, I do. Check the link in the video description for the Amazon links, but these are great to teach you medical coding. They'd be a great refresher if you haven't done it in 2 years to just go through those. Budget-friendly idea. And the other one is I like to recommend the CCO Blitz programs. So if you're someone who needs more than a review, but you don't need an entire full course, that blitz programs that CCO has, they're kind of like that nice in between where you get more than you would in like a one-day review, but not that full course. So it's kind of that sweet happy medium. So that's really good for people who maybe have done medical coding in the past, but you really want some additional study material. And Lori's saying, yeah, practice exams. They have some practice exams for free on CCO. You can buy a couple on AAPC's website. So there's lots of different options there. They're great. John saying, yeah, Carol Buck. Anything, yeah. The Bucks, the Bucks step-by-step books. They're phenomenal. When I used to teach back in the day, I was a medical coding instructor at a tech school 13 years ago. 13 years ago. And these are the books I used and I love them. Fun story. So, I've had a couple of coders that I've known along the way that taught at tech schools as well. When I taught at my local tech school, I was only in medical coding for like a couple of years. They had developed this new program, right? They needed an instructor. And I agreed to kind of work for a little bit cheap because I just wanted the experience, right? And I wanted to dip my toes into I'm just playing with my hair. Did I dip my toes into teaching? Now, one of the most interesting things about this place was they took just about anyone. So some of the students that I had were medical assistant students, and they had to learn like essentials of medical coding, basically, which I taught. I taught essentials and then advanced medical coding. And because they basically admitted anyone, I would have these medical assistant students that would come in and throw all kinds of attitude with me, like, "Couldn't find my sneakers today, so I'm wearing my flip-flops, I hope that's okay with you." And I'm like, "Wow, okay, like, I don't care. Security, they might if they come and do a uniform check. I personally don't care about your flip-flops." But one day, it was so, so sad and so tragic. I had a student come in class late, and they looked so sad, and she said, "Victoria," she's like, "I'm so sad. I'm so sorry." She's like, "I don't have my books right now. They were in the back of my car. I was working as a cashier at the local convenience store, and someone robbed the store, got into my car, and ran my car into a tree." And I checked the news, like, this was actually what happened, but I felt so bad. Like, who how what in the world would prepare you for the moment where you have a student come in and apologize for not having their books because they were in their car and someone used it as a getaway car after a rob like, I uh, but yeah, it was definitely interesting. I could only handle I think I taught there for maybe 5 terms, so maybe a little under a year and a half, and it was time to get out of teaching at the tech school. So let's see. What are some of positions to apply for when you don't have your CPC certification yet? That's a good question. Anything that's like involved in the revenue cycle. So some some healthcare organizations, you'll see them kind of group rev cycle or administrative positions together, so you can kind of take a look at what all they offer. I would say even if you could get anywhere into healthcare, it's good because you'll start, I say first and foremost, once you're already working at a healthcare employer, they have to favor an internal employee versus an external unless that external employee has, like, credentials out the wazoo, way more qualifications, than the person internal, because 'cause they've already got you on payroll, they know you're a good employee, that you're not gonna call out, it makes it a lot easier if you're an internal employee. So even if you're someone who, like, works in registration, you're gonna start getting familiar with some of the systems that they use at that healthcare organization. You're gonna get familiar with different surgeries or terms, insurances. You're gonna get familiar with a lot of the people that work at the healthcare organization, even right, how the medical records might be outlined. So I think that's good. If you get into registration, if you can get into pre-authorizations, if you get into even the billing department, accounts receivable. Sometimes one thing I like to do when looking for jobs online, and I'm gonna use Indeed as an example. If you go into Indeed.com, right, and you type in instead of medical coding, if we type in ICD-10 CM, you'll start pulling in jobs that are looking for skills in ICD-10 CM, not necessarily just medical coding jobs. Now, a lot of them are gonna be medical coding jobs, but you might find things where they're like, "We know we need someone who's familiar with ICD-10 CM to work maybe somewhere in the outpatient beginner coder." Oh, I've never heard it referred to as a beginner coder before. That actually has me a little bit worried. Beginner coder 21 to 27 down, yeah. Hmm, beginner coder. Usually it's like apprentice, entry level. I've never seen it referred to literally as beginner coder. Um, but sometimes you can find some things on there where that will be a helpful skill set to have, and if you've at least gotten that far maybe in your course, you'll be able to assist there. Provider consultant, ooh. Let me know in the chat if you think it would be helpful one day to literally just start kind of going through job listings and breaking down what the different things in them mean, or how you can tell, like, if you're qualified or different ways to find medical coding jobs. That might be a good topic for a live stream. Janet, you know what might be a good option for you is check with your local chapters or even some of the different chapters in your state and see if they're having any kind of refresher courses, or in general, like, get familiar with your local chapters because they're going to have CEUs. If you're struggling in a certain area, you can let them know, because if they find out that a lot of their members are having problems with like E&M, they're like, oh, well, we got to find someone to come in and do E&M. Yeah, maybe I'm gonna make myself a note for that for next week. Next week, we're gonna do live job search. But yeah, check with them because sometimes the local chapters do CPC reviews, read your healthcare business monthly. So for those of you, it's harder to know you get healthcare business monthly now because they only give you the electronic versions by default, and you have to specifically request the paper version. Okay, so I want to talk about healthcare business monthly before I forget, because if you are someone who has passed your certification exam and you need to get your CEUs and you're like, where do I go? What do I do? Um, you have access to Healthcare Business Monthly. And that's actually a good thing to read too, even if you get an interview and people are like, oh, well, you're certified and you don't have a job yet. Like, how are you keeping up to date on what's going on in the industry? You want to say something like, oh, well, I've been reading Healthcare Business Monthly, and that helps keep me up to date and helps me with my CEUs as well. So, also, I want to plug, not sponsored, but the AEPC is actually having a really cool deal that they had last month and continued on to this month, where if you buy the bundle of your code set books, they will give you the paper books and the ebooks for free, and it's like a little under $300, which is actually a pretty good deal, and that's for pre-ordering your 2024 books, not for 2023 books, but if you're pre-ordering for 2024, which I did because I thought this was a pretty good deal. I'm making music here. So, oh, April's Autism Awareness Month. I'm an autism mom. I have a kid on the spectrum, Lizzie. She's amazing. I love her. She's smart, but she socially is just fun, just interesting kiddo. Um, what was I doing? Healthcare Business Monthly. My gosh, Victoria, we're all over here. Resources. So if you go to resources on the AAPC website, right? Right here is Healthcare Business Monthly magazine. And Healthcare Business Monthly magazine, you have, here's your current, oh, look, all my friends are there. Look at that. Once again, anyone on the cover but Victoria. Anyway, member media, there's Brenda, there is Robin, and oh my gosh, I can't think of this person's name. Oh, she's going to kill me. But yeah, so you can download the AAPC magazine. They have their whole archive here, and you can download the PDF. You can look at the e-magazine, so it'll kind of open up on desktop like a flip. There's also on the AAPC app. If you want to use the AAPC app, you can download your Healthcare Business Monthly magazine on there as well. And you can take these little test yourself quizzes. I don't want to bring it up because I don't want it to like show the test and then get yelled at by the AAPC. But you can take these little test yourself quizzes based off of the content in the magazine, and you earn your CEUs, and it looks really good to your employer that you've said like, "Oh, I'm keeping up to date by reading things like Healthcare Business Monthly." There's also Billing and Coding Advantage magazine. That's another great way to keep up to date and get some CEUs as well. That one does charge you to subscribe to it. It's not an obscene amount of money for the year, but it is a chunk of change, versus Healthcare Business Monthly, which you get free. Well, I don't want to say free. You get included with your membership to the AAPC. But if you're looking to learn medical coding from scratch, I do just want to talk to you about today's sponsor. Where are my Yeah, so if you are looking to learn medical coding from scratch and you're like, Victoria, I don't know where to go. What is a good school? Like, what's the salary? Like, you're like, I have no healthcare experience, Victoria. I have no healthcare experience, and I need you to help me out, right? Tell me what I'm supposed to do. How do I get from I don't know what I'm doing to like certified in building coding? Like, I'm job ready in as little as 6 months. Ah, there we go. Um, medicalcodingmasterclass.com. I lay out everything for you, the certifications you want to look for, salary expectations, and tell you about Preppy. And again, sponsor of today's live stream. So Preppy is a program where you can learn medical billing and coding on demand in as little as 6 months. It is a great program. They offer internships as part of the program, and you get a like college certificate at the end. So they're a great program. Um, Do you have to pay monthly or yearly to be a member of the AAPC? So you do have to pay yearly to be a member of the AAPC. If you get any credentials, like the CPC, the COC, the CRC, any of the credentials through the AAPC, you have to pay membership dues annually in order to maintain those credentials. There's no option of getting the credential and paying, X amount of dollars to sit for the exam, but don't have to be a member. You have to be a member, and I don't even know, what is it, $195 or something anymore to join the AAPC? Let's check. Membership, am I logged in? Let's see. Oh gosh, 205, is that what it says now? Oh my god, I need to move those buttons. So membership to the AAPC right now is $205. So that's an annual fee. You have to pay that every single year to maintain your membership with the AAPC. Da, 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 da. Yeah, so the program that I am partnered oh gosh, the program that I am partnered with is Preppy. You can find them at preppy.org as well. And yeah, so like I partnered with them because I have such an abundance of people coming to me that are like, Victoria, I want to learn medical coding, that it's like way more volume that I would be able to handle. So they take care of all my viewers. They give them like way more than I would even be able to provide for them, which is cool. Difference between AAPC and AHIMA. AAPC and AHIMA, they are our top contenders in medical coding, right? They're our credentialing organizations. At the very basic and core level, if you wanna learn inpatient coding, coding for facilities, that reimbursement that the hospital gets, go with AHIMA, otherwise go with AAPC, right? Um, the difference is, AHIMA is a little bit more prestigious. They have more credentials that you have to have certain degrees in order to obtain them. Like the RHIT, you have to have an associate's degree. The RHIA, you have to have a bachelor's degree, and it has to be through an accredited program. AAPC, all I mean, really, if you pay your membership dues and the exam fees, you can sit for the exams, right? Like there's no official program you have to go through. Of course, you might not do very well if you don't know medical terminology and haven't taken a medical coding course, but technically, the requirements are you pay for membership and pay for the exam fees, right? Um, and, echoing what Lori says here, the AAPC does have a lot more networking opportunities than the HEMA does. They have these local chapters. The local chapters have virtual meetings twice a year. They have in-person meetings. There's um, a lot more resources, I think, available with the AAPC and a lot more room for growth. So AHEMA, if we just let me bring up the AHEMA website real quick, and I can show you some of their credentials that they offer. So if we look at the AHEMA website and we go to their certification exams, they're offering the CCA, which is kind of similar to the CPCA. It's more of an apprentice type of position in medical coding. CCS, which is inpatient coding, CCSP, which is for physician or provider-based coding, RHIT, RHIA, clinical documentation improvement practitioner. I don't even know what the heck a CHDA is. There's so many certifications. Certified health data analyst and CHPS, certified health care privacy and security. So not a whole ton. And then if we go to the AAPC, and we look at their certifications, there is a lot more certifications. So you can go get your CPC, COC. They have ones for risk adjustment coding. Is this actually up? Because I feel like they've been teasing us with this certified professional medical scribe for like 6 years. The billing credentials, auditing, compliance officer, um, documentation expert, inpatient, outpatient, practice manager, like, there's a lot more even, like, specialty credentials with the AAPC. So if you're someone who likes to either collect credentials or you wanna, uh, demonstrate your proficiency in different specialty areas or, learn different types of medical coding, AAPC might be better. Cost-wise, I think they're fairly similar. I think the AAPC gives you more than a HEMA does, and, yeah. What is similar to the CCS in AAPC? That would be the CIC, that's the Certified Inpatient Coder, which I believe is the only, if not one of the few, where you have to fill in the blank. Yeah. So most of the AAPC certifications have multiple choice questions, but the CIC has 40 multiple choice questions and 7 inpatient cases with fill in the blank questions. That's intimidating. Very intimidating. Do I like medical coding or do you do it just for the money? Seems monotonous. Valid, valid. I actually like medical coding. I mean, I wouldn't do it for like a hobby. I do have actual hobbies that I like. Um, I think there are periods in my career where it has gotten monotonous, especially if I was kind of tired of a certain type of coding or a certain specialty and I wanted to move on to something else and I couldn't because maybe there wasn't openings or they're like, "Oh, we don't have time to cross train," or whatever. But I've always found it very fascinating because if you think about it, like, you're reading a lot of medical records. So in some of the situations like urgent care or the hospital, that can be very fascinating because some interesting people walk through those doors. It can also be very heartbreaking though, because if you've ever coded, like pediatric, um, hospital cases, especially the intensive care unit for pediatrics, it's tough when you read in the records that the patients are suffering or don't make it home, and that can be it can be tough. And there's times where you have to walk away from your desk and take a few moments and hug your family members a little extra tight. But I mean, Lori's joking about my shirt. But yeah, so there is good money to be made in this industry. I think my last auditing job, I made, like, in the 70,000 range, which was really good, and, if I'd have stayed in it, I'd probably be making in the 80,000 range by now. Um, yeah. Yeah, Lori says my hobby is going to Disney every other week. Not quite every other week, every other month. And I laugh because it's despite the fact that I've been to Disney probably like 12 times in the past, couple of years, I've still never run into Brian Quee, who literally lives like 15 minutes down from Disney Springs. But yeah, sometimes I mean, there's certainly boring moments to it. I had one commenter who said that uh, his mom was also a medical coder or something, and she would complain about it, but he was like, "Oh, well, you make good money, so kind of the juice is worth the squeeze." James is asking, "Is charge capture for the emergency department a good start for coding experience?" John, let me tell you something. My very first healthcare job was working charge entry. I had 2 screens like I do right now. One was my billing system. The other was literally scanned super bills. I don't know if a lot of you who have gotten into the industry in the past couple years are familiar with the term super bill. But it used to be a lot of times when you would go to the doctor, and now everything's electronic, but they would have this like sheet of paper with the common procedures and diagnoses that they would do. And the provider would just go like, okay, I did a 99214 and I did this diagnoses, and then if there was something that maybe wasn't on the sheet, they'd like write it in the corner, and then they'd scan in all of the sheets for the day. And I would get the scans, and I'd sit there and I'd type in, whatever the provider circled, verbatim. I didn't like code them. I just sat there and typed them all into the billing system so that all the bills could go out at the end of the day. So yeah, it's a great way to get into to familiar with things because yeah, I learned the practice management systems. One of the first projects I took on after that was, helping to install charge scrubbers. We were gonna convert to a different practice management system. We were on Centricity, I believe. I don't remember what we were moving on to, if it was a different version of Centricity or whatever. I think they had to stall it because there was, like they overloaded Centricity, like, they had so many users on it that it was literally crashing the system because the version that they got was one that just kind of, like, came out of the box and wasn't really intended to be, like, a large enterprise solution. Um, and yeah, so they had to kind of, halt that because, yeah, the users were crashing the system and had to get a whole different system. I think they wound up going to Epic then. Um but I got that experience then of working on those projects, and it was just because I was working in charge entry. I got my coding certification, and they went, "Hey, this is someone who clearly is motivated and wants to do new stuff," and no one else in the revenue cycle seemed to wanna take on the project, so I'm like, "Hey, yeah, I'll do it." Excuse me. Again, like, after when we start getting close to that hour mark, my throat just starts, like, losing it, and, yeah, that's why I don't do these long workshops anymore. I just start coughing and hacking and blah. Uh, I'm a newer coder who's been in risk adjustment for the last year. That's awesome. How do I transition from HCC coding to outpatient coding? I also got my A removed. So getting your A removed was great. If you're talking outpatient, like outpatient facility, go for your COC. If you're talking outpatient, like physician-based coding, like you want to code for surgeries or you want to code, pediatrics or E&M, go for your CPC certification if you have that. And then you could also just start applying for positions if you've only worked in risk adjustment and you only know the ICD-10 CM, you'll have to start learning CPT and HCPCS. So that might mean that you have to take some additional coursework there in order to obtain your COC or CPC credentials. Does the US hire CPC certified coders from India, and can we work from India to US hospitals? I know there are organizations that do that. I'm not up to snuff with who and what the requirements surrounding that are, but there are organizations that do hire CPCs that are located in India. Do you believe taking courses at a local technical college is beneficial? I only have high school diploma. Yeah. A lot of the tech schools have pretty decent medical billing and coding programs. Most of them, they bundle them together. They're like a medical billing and coding. So you can't usually take like one or the other. They kind of like bundle them together. I would see, what credentials they prepare you for, and if you can, talk to some of your, local chapter officers and see if they think that that tech school is a good option or even people maybe from the local hospital, because I have known in the past that there's, like, certain schools that maybe they have had issues with, and they're like, "Oh," maybe they had interns coming in and they weren't very high quality, and they're like, "Oh, this school isn't really, well revered anymore." Um, but that's my number one thing is check what credentials it's gonna prepare you for, because a lot of them will say the CBCS, and nothing against that credential, but employers want the CPC. So if you still wanna sit for the CBCS, fine, but you really wanna get your CPC or your CCS type, organization. Entry level coding, would you still recommend going through Preppy? My job pays for schooling, but only at the schools they want us to go to. I mean, yeah, I mean, if they're paying for something else, definitely take advantage of that. I'm not gonna force you to go to the one just because I think it's, top notch. And especially if you're already working somewhere, you're not gonna necessarily maybe need the benefits of working an internship. Yeah, yeah. Most employers only hire AAPC or HEMA certified credentialed coders. One of the tips I always say is I think it will make it a little bit more clear, whether it's worthwhile sometimes to pursue a certain coding credential that maybe your school is pushing. Go into Indeed.com, type in that credential, and see if anything comes up. Because I know if I go into Indeed.com and I type in CPC, I know that jobs are going to come up. If I find some off the wall credential and I type it in here and search for jobs for it and nothing comes up or maybe only 2 entries come up, that means there aren't any jobs out there that are looking for that credential, right? That helps me maintain my liability because then I don't have to explicitly say, "Don't sit for this credential." Just type it into Indeed and it'll tell you. Ah, you wanna do yeah, so if the only schools that they're paying for are 2 years. I mean, you really have to weigh that then. Like, do you want the benefit of not having to pay for it, but then it's gonna take you 2 years? And also make sure you check with your employer because sometimes they will put in there like a stipulation that you have to stay there for a certain amount of years afterwards, otherwise you have to pay it back. So, yeah, that's something to consider, like, do you wanna wait the whole 2 years, or do you wanna go through a preppy program where you can pay them, as little as $1,600 on a payment plan and, um, and be done in, 6 months. Hello there, Sarah, it's good to see you here. What are some recommendations for practice CPC exams that are preferably free or low of cost? I've purchased a few from the AAPC and taken the ones on the COC platform. CCO.com has one. I know Lori does. CCO.us. She could probably drop the link right to where they have their free ones. Let me see if I can find it on the website, though. I bet I could find it really quickly on Google. Free practice exams, cco.us. There we go. All you have to do is go into Google and type in free practice exams, cco.us, and it'll come up. I also have one on my website that is, hold on, I don't want to take you to the back end of my website. Let me check what I'm doing here. Contempo coding. I have 2 Google reviews. What? I don't know where those came from. Yeah, so if you go onto my website, I have a review class that does come with a practice exam, and I just renewed my license with the AAPC, so all of my CEUs terminate at the end of this month, and then I have to reapply for all of them again. So there might be this tiny little period at the beginning of May where CEUs are not applicable until I get them all resubmitted, and that's $30. Da, 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 da. I've seen some books online through, like, Amazon and through eBay and stuff, or even Etsy where they offer practice exams. I wouldn't recommend that. I know they're tempting because they're cheap, but oftentimes what I found is they're old editions, they didn't update them, they're full of errors. The format is weird, like, it doesn't match the kind of wording and format that you could find that's actually gonna be on the AAPC exams, so I would steer clear of the Etsy, eBay, Amazon prep type stuff. Does Preppy prepare you for the CPC exam? Yeah, so Preppy prepares you for a couple of different certifications, the CBCS or the CPC. Um, and I would definitely recommend getting the CPC certification, and it does count towards your apprenticeship removal. So they do give the contact hours required and can help you with that year of your apprenticeship removal for that as well. We are almost at the hour. I'm getting wiggly. Do you guys wanna see so I don't know if you guys can see this. I need to get some lights back here. I've been decorating my shelf. I still have a couple of spaces left. I just moved this in from my old office, and, it was on, like, a corner, so it never got shown in video, but this is my curio. If you can see it up close, you'll notice that these little characters up here are actually Pokemon, so I have Pikachu and Squirtle and Bulbasaur and Charmander in there, and they were 3D printed, and I spray painted them rose gold, and I made them in this cute little curio, so you can't see what they are from far away. Up close, now you know the secret that I have little Pokemon sitting in my curio back there. You know what, Lori? I actually got the cutest Christmas ornament a couple years ago that someone made for me, and it's this little piece of wood, and it says Contempo coating on it, and they glued all these little pieces of paper to make these tiny little CPT, ICD-10 CM, and HCPCS manuals on this ornament. It is the cutest thing. Like, I love being able to take it out every year and see my little Contempo coating wooden ornament with the little flippable books in it. It is just so cute. Yeah. No, this is the new office. Yeah, this is the new office. I've been rearranging it a little bit. I'm gonna do a studio tour maybe this week or next. Um, I'm hoping that I have enough stuff going on to post it though as bonus content because I hate to be like, oh, this week's video is come and check out my setup in my studio. But I am actually going, and this might actually be kind of pertinent to what we're talking about because I saw someone post something about this online recently on a Facebook group, and I wanted to respond, but I didn't, and they said, "Hey, does anyone recommend any good eye drops? Because I'm sitting and staring at my screen so much, and my eyes are getting dry with my contacts and so forth." So I have been struggling with this for a while. So I only wear my contacts when I'm either recording videos or live streaming because my eyes get so dry and they get tired and it just bothers me. So I wear my glasses most of the time. Um, and then when I travel, I actually got a separate prescription for daily contact lenses so that I wouldn't have to worry about the contact lens solution. So I'm saying all this to say, I guess in 3 weeks, I'm going to have laser eye surgery so that I don't have to worry about the contacts, glasses, if I'm wearing the glasses to light like, that I'm not reflecting something when I'm lighting, and I'm just like, I'm so excited, like, to be able to go and get laser eye surgery and not have to worry about it, because the contact drops that I was using, I don't know, Renews or something, and it just wasn't cutting it. It was still my eyes were just like, "Whoa." JG, so I know my knowledge of inpatient coding is like that much. It's really not a lot. Um, as far as DRG weights, clinical status indicators, if anyone has anything, please drop them in the comments to help JG out because that's not my forte. One day, maybe, but not today. So it is 3 o'clock. We're at the hour. And I had a great time with you guys today. I'm gonna be back on Friday, and I think we're gonna go with doing the live job search, and we're gonna dive into some things, look at them, and as I'm going through, kind of give you some tips on maybe some things that might be red flags, or maybe some things that will help your job search. We'll go over that next Friday. Guys, it was great. Until then, keep on coding on. Bye.